sketches. I've had carpets, I've had sofas, I've had drapery, and of course we can't forget the all-important air ducts. The air ducts are, something you'd never think about. You have them done, you have fresh air. It's smelling good.
Right now, save 40% on all carpet, drapery, upholstery, air duct, and tile and drop cleaning.
Yes, I am a real Coy customer. This is really my house. This is really my sofa that they clean. They've done a great job.
People you trust Coy.
Hi, may I help you?
Yeah, I'm looking for car insurance that isn't going to break the bank.
You're in the right place. Only Progressive gives you the option to name your price. Here.
Price cut?
Mm-hmm.
So I tell you what I want to pay.
And we build you a policy to fit your budget.
That's cool. Feel so empowered.
Power to the people.
The option to name your price. New and only from Progressive. Call or click today.
Well, everything is in its place, and I can't stop the smile on my face, 'cause I'm happy in this place. 1, 2, 3, so smile, smile, my friends. You're in a happy place, so smile, smile, my friends.
Save 30% or more on your San Diego vacation at sandiego.org/happy-deals.
Audiences are cheering for the most inspirational film of the year.
There's a woman that has struck not just for herself, but for us all.
Critics are calling it amazing, a must-see film.
I'll never, ever leave you again.
Sensational.
Take the plea. He will leave you alone. I did not do anything.
A gem of a movie.
These police been running this project since I was a kid.
Why is that in your business?
They made it my business.
American Violet, rated PG-13, in theaters Friday.
At Carol's, you love our prime rib, and now you'll love the price. Only $10.99 for a full prime rib dinner for a limited time. So come to Carol's today for a $10.99 prime rib dinner.
Tanya Gluto is a 36-year-old chef who cut her finger at work. Within 60 hours, a deadly bacteria seeped into the cut and started eating away at her flesh. Tanya lost her arm, right breast, and 9 pounds of flesh from her body. There are a few things you can do to lower your risk of getting a deadly infection. Wash your hands often. Keep all wounds like cuts, scrapes, and sores clean and covered. Look for signs of infection like pain, swelling, redness, or high fever. And if you have muscle or joint pain and develop a fever or chills, get medical help. So we're here with Tanya. So Dr. Ross, can you explain what Tanya got and how it happened?
It's called necrotizing fasciitis. It's a big scientific word for it, but what really happens is the bacteria got into your fingertip and it burrows down to a muscle. And once it gets to the muscle, it goes to tissue around the muscle and begins to grow up that muscle. So it's underneath the skin. That's why you're having shoulder pain. And then it liquefies it, it melts it, and you begin to dissolve. That's why it's called the flesh-eating bacteria, because it literally takes away the inside of your body. Yet on the outside, as you look at it, it doesn't look any different. But unfortunately, the toxins that are released from these bacteria, by the way, the most common cause is streptococcus, strep bacteria. It's the kind of thing that gives you strep throat. Somehow it releases toxins, and those toxins can destroy your lungs, your kidneys, and cause shock. The whole system shuts down. And unfortunately, 3/4 of people don't make it if they don't get attention within 2 days, which is why it's a miracle. I mean, you really are. And if you were to go back again, I mean, you wouldn't be here right now. There's no way.
I think we
Good,
had
Bailey. Come here.
a similar story.
Bailey.
The woman who had,
Come here. Bailey. Good, Bailey.
Went into the hospital, had a C-section, flesh-eating bacteria, ended up having to have both arms and both legs amputated because
I was in Florida.
Yeah.
It was just right after this happened.
Really?
When I got out of the hospital, I saw that story.
Yes.
And I couldn't believe it. But actually, I
Hi,
was in the
sweetie.
hospital 3 times. That was the second day
Hi.
that I went in. And my
Hi.
blood pressure was 80/40. And they didn't
Sweet.
they didn't really see anything. They gave me
Stay in the camera.
and sent me home. But from the beginning, and I had constantly asked
Bailey.
questions to a blood test. I know this is working comp. This haven't worked. I'll pay for the blood test. Let's just do a simple blood test. Let's see.
The problem with this condition is you're not going to see a lot on a blood test. You'll see some soft things, like maybe the white blood cell count. count will go up. We do screen for that. But the main diagnosis is made because someone listens to what you're saying. I think of all the things to take away from this story is the reality that we have to be able to over and over again be assertive in verbalizing what our body's telling us. And in the medical profession, we got to listen better. Because when you go in there and say, I've got a lot of arm pain, I don't complain a lot, there's something wrong here, and then you go again into the same thing, someone's got to look deeper. Because the only way is to actually examine you, look, take the shirt off, figure out what's going on to that tissue underneath there. Would you mind if I felt this? No. I can't hold myself back. It's okay? You sure?
Yeah.
All right. It's very thin. Yeah. Does it hurt when I'm doing this?
Yeah.
Oh, stop. Why didn't you tell me?
I mean, we're curious.
I know, but still.
Well, thank you for sharing this story with us. It's really unbelievable that this happened to you, and we're so happy that you survived it. Really. Thank you. Thank you. Thank you for being here. Coming up, a deadly superbug rapidly spreading throughout this country, what you need to know and how you can prevent it. Next.